when talking about low back pain, a lot of the times we get into this thing called the pain spasm cycle, where basically when a muscle spasms, right, contracts really hard, gets super tight, that causes pain because we're getting squishing of nerves and you get some different fluid dynamics, yada, 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 science, right? That pain then actually goes back and causes more spasm because the back is trying to protect itself. So you get into this pain spasm pain cycle that is just a feedback loop, right? So it just keeps going and going and going and going. How do we break that? Especially when we may not be able to access an individual like a chiropractor, PT, manual therapist, anybody that has the technique and skill to kind of get in there and bust it up for you. We have another video that's kind of a cute back, hey, I'm stuck right now, what do I do? Go ahead and check that one out. This specific lacrosse ball low back mobility drill is a little more advanced and not necessarily for individuals that are in excruciating pain, you know, like just get me out of this kind of a thing. Go ahead and watch that video up here. But we're gonna scale this up a little bit. So after your low back has started to calm down, what's the next step? How do we kind of increase that intensity on our little mobilization drill? So for all of this, I'm looking to go for the little bony guys in the back where our dimples are, right? Those dimples back there. These are the back sides of our pelvis, right? The PSIS is the fancy term for it, right? We want to be just inside, close to the spine as we're doing this, right? So if I find that bone, I'm going to fall right to the inside. The lacrosse ball is going to hang out right around here and maybe a little bit higher, a little bit lower, depending on your situation. Nice. So what I'm going to be doing is I take that, I place that there. The way that I want to kind of manage it is I want to have my hands in kind of this little diamond shape. That'll get my fingers out of the way so I don't crush them or anything like that, and make sure that I keep the lacrosse ball where it needs to happen. But I'm gonna lay flat down on the ground. Right now it's on my left side, so off to the left side of the spine. I'm gonna keep my right leg, so the opposite leg, planted on the ground in kind of this little bridge, right? The lacrosse ball is lifting my pelvis up, so I'm just literally relaxed right here. The motions are this. I'm gonna bring the left leg, so the leg on the side of the ball, I'm gonna bring that up towards my chest. Once I kind of feel it get tight, I'm going to straighten out the leg and then slowly drop the leg down. Almost like I was walking, right? As I step forward, my knee comes up, I straighten the leg out, I straighten the leg, or let the leg fall down, and repeat. This kind of cyclical motion will allow for some of the muscles that control that leg, that are influenced in the low back, to try to figure their stuff out, while this new stimulus of the lacrosse ball pushes on those systems and has it try to figure its way out, right? Once that kind of desensitizes, I'll lean away and I'll roll it up just a little bit, right? And same idea, I'm holding that ball, up, out, down, up, out, down. And from here, right, one side may feel nice and loose, I can go ahead and transition to the other side. Now, to make it more intense, right, I can straighten out the opposite leg, right? So right now I'm on the right side working on it, right? We're doing the knee to chest, straighten it out, lower it down. Once that gets nice and loose, I can straighten out the other leg and do that same motion. I get a nice little hamstring stretch as I straighten out the leg, and all these systems work together. So realistically, this is a great way to start to get the low back, the back of the leg, the hip flexor, all of them to start to work together to reduce some of your back pain. It's a pretty intense drill, so I don't like to do a lot of it. I would say you're doing this once, maybe twice a day, depending on your situation. If you're super acute, i.e. everything just happened not too long ago and that low back is still pretty flared up, I'd only probably do this once a day, using the other stuff that we talked about in the previous video to make sure that we're mitigating some of the pain and whatnot. But once we're kind of out of that super symptomatic, oh, my back hurts all the time thing, we can start to progress to 2 times a day. I'm spending about a minute or so on each side. Now, it doesn't have to be a continuous minute. You can kind of throw the lacrosse ball out, take a break, windshield wiper your knees, just kind of back and forth. Let that low back kind of breathe a little bit, but spend some time in those tissues, especially getting that leg doing the cycling like we would be walking, and that should really start to help that low back.